So this study is a phase 2 study that we wanted to evaluate the combination of isatuximab, pomalidomide, and dexamethasone that has been approved, but from the third line and beyond. We wanted to check what is the value of this combination at second line in patients who have been exposed to lenalidomide. This study has also another important point, that after the patient have achieved a very good partial response, we randomize them to receive isatuximab as standard every 15 days or isatuximab monthly, in order to see if with a so-called maintenance type, isatuximab can be given monthly, like daratumumab, for example. So we present here the first results of the first 40 patients of the study, where we have seen that the response rate is what we expected, around 70%. And of course, the median PFS has not been reached yet, but we are expecting with the new updates of the study to see exactly what the median PFS will be for this specific subgroup of patients, where the majority of patients were lenalidomide refractory.